On December 31st last year, China alerted the World Health Organization to several cases of pneumonia in Wuhan, a port city in China. The virus was unknown. Several of those infected worked at the city's Huanan Seafood Wholesale Market, which was shut down on January 1st. On January 7th, however, Chinese officials announced that they had identified a new virus according to the World Health Organization, the novel coronavirus, which goes by the code 2019 nCoV.
The coronavirus family we have known about for quite a while. There have been a number of introductions into humans. These viruses normally circulate in the animal world generally, and from time to time they jump the species barrier into humans. So we've had MERS and SARS are all coronaviruses. So whenever there's a new virus, there's no population immunity to the virus because nobody has had it. So as soon as this new virus emerged, the first thing is to learn as quickly as possible about it. Now, among the spectrum of coronaviruses, some of them cause a very severe illness and others cause a very mild illness, respiratory illness. And the two key characteristics for a virus for which we use to evaluate how serious a virus is one, the transmissibility, i.e. how quickly that virus can be transmitted from one person to the other. The other is virulence or mortality, i.e. the proportion of people that die from this virus. We're talking about a virus that generally causes a mild illness. 80% of cases so far reported have had a mild fever, cough, cold, something most of us would have very many times in a year. About 16% have had a severe illness that requires hospitalization.
From the Chinese city of Wuhan, where the coronavirus outbreak started, it has spread to the Asian Pacific regions, Europe, North America, and the Middle East. It has so far killed hundreds of people in mainland China, other deaths elsewhere, and infected thousands of others. This was after it got to a point that the World Health Organization declared the novel coronavirus a global health emergency. In the wake of the coronavirus and its attendant effects, some countries have discouraged travel to China and several airlines have cancelled flights. Although the coronavirus has not been confirmed in any African country, Nigeria, Africa's largest population and an ally to China, expressed its solidarity with China at this trying period of ravaging coronavirus.
Here in Nigeria, we know that yes, there is an outbreak in China. We know that if there is an importation, it can be anybody. It can be Chinese, it can also be Nigerians, because there are hundreds of Nigerians resident in China who may be coming home. So it can be anyone who is coming in. So we are not doing any profiling. No national profiling, no racial profiling.
At the moment, the risk assessment, which is based on WHO's risk assessment, is not, and its advice is not to stop trade and travel. The reason for this is China is actually implementing everything WHO has recommended that they do and doing more. So if a country is doing everything that they should be doing, the global advice is then to provide them with solidarity and not stigmatization. So the risk is in the activity of traveling when you're ill or when you've been exposed, and there are ways of mitigating that risk. And at the moment, we are doing everything as advised by WHO in Nigeria to identify those infected potentially and coming back. So the goal of this is to maintain, even when there's an outbreak in a country, this time it's China, it could be anywhere else. Our goal is to maintain a certain openness and transparency that allows information exchange to happen between countries so that countries are confident to share information when there are outbreaks. The restriction in trade and travel is really an extreme measure, and at the moment WHO's advice is that we're not at that point. and therefore we have to keep do what we need to do to prevent viruses from coming in, but not yet ban trade and ban travel between both countries.
While ensuring utmost alertness and proactiveness to guard against the importation of the disease into Nigeria, both countries are united in the hope of ridding China of the disease and in preventing it from spreading to Nigeria.
Fighting the spread of epidemic is a common concern of the international community. China is willing to work with other countries in the world, including Nigeria, to respond to the epidemic actively. We have informed WHO, World Health Organization, relevant countries, and China's Hong Kong, Macau, and Taiwan region of the latest epidemic situation, and have shared information on virus gene sequences with all parties at the first time.
Yes, the Chinese government has been very cooperative. The Chinese ambassador was here in this office just a couple of days ago to explain so far what they are doing. They have been helpful in that they do also not only screening of those who enter their country, but they screen those who are leaving their country, which is very useful. So if they detect anyone who has a fever or who does not look well, they do not allow that person to board the plane. That is a very good step because it protects passengers on the plane. We have also been in touch with Nigerian ambassador in China, Ambassador Jida, who has told us that he's in touch with all Nigerian communities, particularly communities in Wuhan, where there are about 60 Nigerians, and there is no report of any one of them falling ill. 2 of them are in hospital, but for things that are not related to coronavirus. So they are monitoring the Nigerians there, and there is no fear of anything. The Chinese ambassador told us that they have been able to cure 475 patients and discharge them home, showing that coronavirus can be cured, and we have requested them to share with us any protocol that they've used in the treatment so that we ourselves are prepared. Even though we don't expect any case, we want to also to be prepared to treat if any case pops up.
So the measures that we've put in place to prevent the virus from coming in are several-fold. The first and the most important one happened many years ago when we set up the Nigeria Center for Disease Control that has the responsibility to consistently do risk assessments, risk analysis, and response. So we're not faced with a new outbreak and we're looking for who will respond. We already have an agency with a clear mandate. The second thing is, as soon as this virus appeared, we started putting measures in place. Because this virus is outside the country, the first line of defense are actually the port health services at the airport. Our role is to provide them with the information and the science that they need to define their response.
This is the Incident Coordination Center, Nigeria Center for Disease Control Incident Coordination Center. It is like a situation room where we monitor public health events that can pose threat to Nigerian public. So a typical day for us at the Nigeria Center for Disease Control Incident Coordination Center is that we have colleagues looking at data, looking at disease threat across the globe, and locally at Nigeria, looking at the events in Nigeria that can pose potential threat for public health. So at the ICC, we have our screens that will monitor the spread of this outbreak in real time. We can see where it is happening, we can see the numbers affected, we can see the number of deaths, and we can see how quickly these things change. So we have a coronavirus preparedness group that sit down daily and look at those disease trends and advise the leadership on what to do and how best to prepare and respond to an eventual or possible importation of disease to Nigeria. So we don't work alone, we work together with stakeholders across board. We have people from WHO, we have people from the port health services that support us. We have conducted several risk assessments, and we have also developed public health advisory that we shared widely to the general public on how to prevent an importation. We issue travel advisories, and we also have public health advisories to the public on how to take care of themselves in case if they have come into contact with somebody that came from China.
Mindful of the link between the various entry points into the country Especially the airports, there is high alert and enhanced port health surveillance activities.
We have been taking very stringent measures based primarily on the port health services and also on the Nigerian Center for Disease Control. What we have done so far is to make sure we have strengthened observations at the points of entry. We are not discounting any opportunities of land or sea entry, but we believe that 99%, if the threat is anything to go by, will be by air. So we're focusing on our airports, thermal scanners, observation of all patients coming in, and also using the facilities of the immigration and customs in collaboration with the Federal Airports Authority to scan all people who walk in through our borders. Anybody who has any sign of a suspicious illness is taken aside and interviewed for his travel history, and the documentation is made. We have 5 international airports, 3 are very active, and 1 is shut down at the moment, 1 is minimally active. And those ones all have, the 3 main ones, Lagos, Abuja, and Kano, have the facilities we require. They also have isolation centers in those 3 cities, and a well-practiced team of port health experts. The federal government has been extremely supportive in giving us the resources we require. The port health services has received 71 million naira to improve its services.
Even before the outbreak of coronavirus, we have had ongoing surveillance, which we have since scaled up after the report of the outbreak of coronavirus in China. So we have reached a high level of preparedness, and preparedness actually is a continuous process. So we continue to evaluate our systems and amend and adjust what we need to do. So we have ongoing surveillance, temperature detection with thermal scanners, visual observation. Now we have introduced health screening forms that every passenger is expected to fill on board. And once they arrive, we're looking at those forms to look at their travel history and a few other things on the form that will decide whether we want to take it further and ask them to step aside or not. So the government has intensified efforts to ensure that coronavirus is prevented from coming into Nigeria. And in the event that it does arrive, containment measures are also being scaled up. The facilities in Lagos, Abuja, and Kano, they're there, but obviously perhaps Kano is not at par with Lagos and Abuja, probably because of volume of traffic and all that. But we're looking into that, and we're bringing Kano, Port Harcourt up to speed as well. And even though Enugu is closed down, we're making contingency plans. So if this carries on when Enugu is opened, they will immediately join the preparedness that is going on now. So we're looking at all the airports holistically to ensure that they're at par and we all reach a high level of preparedness for this.
The media have also been on top of their acts in view of the roles, which include to inform, educate, enlighten and sensitize the public on issues around the novel coronavirus, which the Nigerian Television Authority setting the pace.
Yeah, the Honorable Minister of Health pulled together an multi-sectoral, interagency meeting, really recognizing that there's no one organization that's able to have all the resources and the mandate to control an outbreak like this should they happen in Nigeria. People coming through the airports have specific responsibilities. Immigration has specific responsibilities. The Minister for Information, who attended the meeting, has a lot of responsibility in terms of educating, informing Nigerians. So it's really recognizing that outbreak preparedness and response is a total societal responsibility. The private sector, public sector, government, state, local government, hospitals, clinical services, all of these have a role to play in outbreak response. And
we will deploy all our platforms, FRCN, NTA, the News Agency of Nigeria, and in particular the National Orientation Agency, which has a representation in each of the 704 local governments of the country. to actually, help to educate Nigerians about this outbreak of epidemics.
NTA has been proactive. If you have been watching what we've done, or what we have done, or what we are still doing, you see that every day, there is no day that we don't mention the coronavirus. We brought in several experts, the Minister of Health, all the relevant agencies. We brought them on to our live programs, even our recorded health programs, to talk about this virus and how to prevent it from getting into this country and the precautionary measures you are supposed to take so that you don't get this disease. And other than that, we have several jingles running, at least on daily basis, not less than 50 times. We have about 2 or 3 running on NTA to educate the public about this coronavirus and the preventive measures you should take. And I believe that so far we have been able to enlighten the public, but it doesn't mean we will stop. It's a continuous thing. And whatever is out there that the public needs to know, we are mandated to broadcast and let people know through our various platforms.
Radio goes to, the grassroots. They listen to a lot of radio, so we realize that. And since the outbreak of the coronavirus, we have been doing a lot of things in sensitizing Nigerians about the dangers and most importantly, how to prevent themselves from getting infected. It's not that it has reached Nigeria yet, but I think there are certain preventive measures that people have to take. We have done Radio Link, which is an interactive program of 2 hours, where we have experts that participated in that, and people from all over Nigeria calling into the program to ask questions on how to take preventive measures. Beside the Radio Link, we've also had a news commentary. During our network news, we try as much as possible to highlight the issues, to again inform people of the current situation, especially as regards to China. Now again, Radio Nigeria does not just present programs in English. We do it in local languages. We have national stations, especially we have a big station, the Kaduna National Station, which broadcasts in Hausa. Again, we have stations in Ibadan, we have stations in Lagos, we have stations in Enugu. So we instructed all the directors in those particular zones to have jingles that will sensitize Nigerians on the preventive measures that they are supposed to take. And they do this in consultation with the relevant health authorities. Again, we have a jingle in English that is running on our network news, and we want to continue to do that.
To be forewarned is to be forearmed. And of course, long before the coronavirus scare or epidemic started, the National Orientation Agency has already been on the field on sensitization and advocacy on the ravaging Lassa fever in the country. So when the coronavirus scare came, it fitted very well into our sensitization and the public enlightenment efforts on how to stay safe. The federal government, through the relevant agencies, and of course the National Orientation Agency is a strong partner of the Nigerian Center for Disease Control. We have worked closely with the Nigerian Center for Disease Control to get all the requisite information about what the coronavirus is, the symptoms, the gestation period, its nature, its manifestations, so that this information so gotten had been translated into English, to Hausa, and to Fijian, which we send out to our state directorates and asking the respective state ministries of health to partner with our offices.
Meanwhile, the Director General of the World Health Organization, Tedros Ghebreyesus, said the steps China took to fight the virus at its epicenter were a good way of stopping its spread, a lesson, no doubt, for other countries.
We're watching very closely and learning a lot, especially from measures that are within the mandate for us specifically of the China CDC. But what China has done now is go over and beyond normal public health measures. So it's been amazing to see the speed at which they have built new hospitals, the way they've managed to restrict movements in the country, and I think there's a lot to learn.
So far, it has not been confirmed, that this is in Africa yet. So we hope to keep it like that and continue to bring you authentic information.
The final word is for all Nigerians, particularly those who travel, to ensure that they do not make contact with people who are suspected to be, who they suspect to be not well, particularly coughing and sneezing. And if such is the case, they should report that. And those who are not feeling too well should also voluntarily report. And those who are, even those who are very well and feel very well, should cooperate, because in order to be able to get our strategy right, we need the cooperation of everybody, both those who are healthcare workers and those who are the visitors and those who are entering the country. So if we are given a form to fill, please fill the form. They are giving a number to call in case you are not feeling fine. You call that number. We need cooperation, and also agree to be called and to answer your call if we need to find out how you are doing. It is a very important part of keeping our country safe and keeping the virus out of Nigeria.
Diseases, they say, know no borders, but the Nigerian government is confident that though the novel coronavirus is a global health emergency, as declared by the World Health Organization, preventing its spread to Nigeria entails all and sundry being alive to their responsibilities.